All right, you guys wanted a deep dive into the world of person-centered therapies. Well, get ready, because that's what we're doing today. We're diving deep into this really fascinating chapter from a psychotherapy textbook.
It's all about person-centered therapy, focusing mainly on Carl Rogers, and then, of course, motivational interviewing, kind of like a branch off of that.
Yeah, and we'll get to meet some of the people behind it all. Like we've got Carl Rogers, of course, the big name there,
Yeah.
and then William Miller as well.
Yes.
But before we get ahead of ourselves, let's lay the groundwork. So, person-centered therapy, where does it all begin?
Well, it all started with a guy named Carl Rogers. And to really grasp this approach, you've got to understand his life, his background.
Yeah, tell me a bit about that. What was his deal?
So picture this. Rogers, he grows up on a farm in Wisconsin, a super strict religious upbringing, like huge emphasis on rules, meeting expectations just to get a little bit of approval. That's what he later called conditions of worth. And it really shaped his whole view on human nature.
It's amazing how those early experiences can have such a ripple effect, you
Yeah,
know?
right.
Like going from a farm in Wisconsin to like revolutionizing therapy. That's
Yeah.
quite a jump.
It is. He eventually found his way to clinical psychology, but his early training was actually in a very Freudian setting.
Yeah.
And that whole traditional top-down therapist-patient thing, it didn't really sit right with him.
Yeah.
He started to question those power dynamics.
I can see why. It seems like his work at a child guidance clinic really pushed him to break away from that. Like he really started to develop his own ideas there.
Absolutely. It's interesting because it wasn't just theory for him, it was real-life challenges, you know? He was working with families, seeing these struggles firsthand.
Yeah.
And he noticed something. He saw that people, even when they were going through tough times, had this drive to grow, to change. He called it the actualizing tendency, this force inside us that pushes us to be our best selves.
I love that. So it's kind of like that natural drive we see in nature, right? Like
Yeah.
a seed pushing through the soil to reach the light.
Yeah, exactly.
We all have that potential waiting to unfold.
That's a great way to put it.
Yeah.
But Rogers also recognized that sometimes our experiences, especially those early conditions of worth we talked about, can mess with our sense of self. We develop this self-concept, this image of who we are.
Mhm.
And sometimes it doesn't match up with our true potential.
Oh, I totally get that. Like when you feel this pressure to be what others expect, even if it doesn't feel right.
Right.
It's like carrying this weight, those conditions of worth, holding us back.
Exactly. And Rogers believed that that gap between who we are and who we think we should be, that's where a lot of our struggles come from. So therapy, for him, was about bridging that gap.
Okay, so that brings us to person-centered therapy, right?
Yeah.
It's about setting the stage for that growth to happen.
Yeah.
And I know he talked about these 6 conditions that are crucial for this whole approach.
That's right.
Can you break those down for us a little bit?
Okay, so the first one is that there has to be a real relationship between the therapist and the client. Not just professional, but genuine, you know? And the client has to be open to change.
So it's like a two-way street. There needs to be that trust, that spark between them.
Exactly. And then the next 3, they're all about the therapist. First, they have to be genuine, which means being real, transparent. Then there's unconditional positive regard, which basically means accepting the client no matter what. And finally, accurate empathy. The therapist really gets the client's world, and they show them that understanding.
Okay, I'm curious about that genuineness thing. Does that mean the therapist just spills all their secrets?
That's a good question. Even Rogers, he changed his mind about this over time. At first, he focused on the therapist's own inner truthfulness, but later he saw the value in sharing personal experiences, carefully, to connect with the client, model that authenticity.
That's pretty cool. It's like even the pioneers, they're always learning,
Yeah.
always evolving.
Yeah.
But those 6 conditions, are they really all it takes? Like the magic formula for change?
Well, that's the big question, isn't it? And honestly, it's caused a lot of debate. Research shows they're definitely super important, but they might not be the whole story for everyone. Like specific techniques or the client's own motivation, those things matter too.
So it's more nuanced than just checking boxes.
Absolutely.
It's about understanding these conditions deeply and realizing that therapy is a complex process.
It is. And another thing, person-centered therapy isn't just about reflecting feelings back to the client,
Right.
It's about helping them become more aware of their experiences, their emotions, what they mean.
So it's not just parroting what the client says, but helping them process those feelings in a new way.
Exactly. Rogers described the therapist as like a surrogate information processor, someone who can guide the client towards deeper understanding.
I like that. It's like having a guide to help you navigate through a maze. They don't tell you exactly where to go, but they help you see the path more clearly.
Exactly. And that's where catharsis comes in, this idea of creating a safe space to really experience and express those emotions, letting them flow.
It makes sense. Like, we try to control our emotions so much, put on a brave face, but then all those feelings just get bottled up.
Yeah,
It's like trying to hold a beach ball underwater. Eventually, it's going to pop up.
exactly. And that release, that catharsis, it can be really healing. It's about letting go of those defenses and just allowing yourself to feel, even if it's messy.
Okay, so we've talked about how person-centered therapy helps with inner struggles, but what about relationships with others? How does it apply there?
Can't question. Rogers believed that those core conditions we talked about, like genuineness, empathy, unconditional positive regard, those aren't just for therapy. They're the foundation for any real intimate connection.
Therapy becomes a model for how we can build those deeper, more authentic relationships in our own lives.
Exactly. When we feel truly seen and accepted, when we can be ourselves without judgment, that's when intimacy can really blossom.
I love that. And what about those trickier parts of relationships, like conflict or even hostility? Does person-centered therapy have anything to say about that?
Oh, definitely. Rogers actually saw hostility as a reaction to feeling controlled, like your true self is being stifled. It's not about condoning aggression, but understanding where it comes from and finding healthier ways to express those needs, setting boundaries.
It's like that saying, hurt people hurt people. Not excusing the behavior, but recognizing there's often a deeper pain behind it.
Right. Now let's shift gears a bit and look at how person-centered therapy tackles specific challenges. Let's start with anxiety. Rogers, he didn't see anxiety as the root cause of problems, but more like a consequence of that incongruence we talked about earlier, that disconnect between who we are and who we think we should be.
So it's not about eliminating anxiety altogether, but understanding what it's trying to tell us.
Exactly. It's like a signal that we're not living in alignment with our true selves. And those defenses we use to push away anxiety, they're actually attempts to protect that fragile self-concept.
Interesting. So it's more about listening to those feelings and figuring out what they mean.
Right. And then there's self-esteem. Rogers believed low self-esteem also stems from that same incongruence. The more we try to live up to those external conditions of worth, the further we stray from our authentic selves, and our self-worth takes a hit.
It's like we're chasing after someone else's definition of who we should be instead of embracing our own unique awesomeness.
Exactly. And that chase, it can be exhausting and ultimately unfulfilling. Now, Rogers also came to see freedom and responsibility as key concepts, particularly in his work with couples and families.
But isn't there a bit of a paradox there? Like, we're shaped by our experiences, but we also have the power to choose.
That's the heart of it. Person-centered therapy emphasizes a shift from external control, being driven by those internalized conditions of worth, to inner control, making choices aligned with our true selves.
So it's about recognizing that we have that capacity for self-direction, even though our past has influenced us.
Exactly. And speaking of self-direction, Rogers had a lot to say about communication. He believed that effective communication hinges on empathy. When we truly listen to and understand each other, those perceived barriers to communication start to crumble.
It sounds so simple, but how often do we really listen to understand rather than just waiting for our turn to talk?
That's the challenge, right? But Rogers believed it was possible, and he even saw this principle at work in broader social contexts, like conflict resolution and peace building.
So person-centered therapy isn't just about individual healing. It has implications for how we interact as a society.
Absolutely. And it all comes back to those core values of empathy, genuineness, and unconditional positive regard.
Those values seem to keep popping up. It's like they're the golden thread that runs through all aspects of person-centered therapy, from individual growth to relationships to even larger social systems.
And that thread leads us to another key figure, William Miller and his development of motivational interviewing, or MI, taking those person-centered principles in a fascinating new direction.
Okay, MI. I've heard a lot about this. It's like person-centered therapy got a makeover, right? Tailored for specific challenges like addiction or health behavior change.
You got it. Miller, he started as a behaviorist, actually, studying alcoholism treatment, and he stumbled upon a surprising finding. Empathy was a major predictor of success, regardless of the specific techniques used.
It's like those core conditions we talked about, genuineness, empathy, unconditional positive regard, they were making a comeback, but in this new, more targeted form.
Exactly. And MI really took those principles and ran with them. It's all about helping people find their own motivation for change, less about convincing them to change, and more about guiding them to discover their own reasons for wanting to make a difference.
It's like holding up a mirror, helping someone see their own reflection more clearly instead of trying to force them to see what you see.
That's a great way to put it. And there's this cool acronym involved too, ORSS. Open questions, affirmation, reflective listening, and summaries. These are the core skills therapists use to create that safe, collaborative space for change.
So it's like the therapist is a skilled navigator, helping the client steer their own course. Not dictating the destination, but providing the tools and support to get there.
That's a great analogy. And one of the things that makes MI so effective is that it recognizes and works with ambivalence. Most people facing a big change are going to have mixed feelings about it.
Totally. Like, I know I should quit smoking, but I also really love that morning cigarette with my coffee.
Yeah, exactly. MI doesn't shy away from that ambivalence. It embraces it. Helps the client explore those conflicting feelings and find their own path forward.
It sounds so empowering. But what about the research? Does MI actually live up to the hype?
The research is really positive, actually. MI consistently does better than no treatment or waitlist control groups, meaning it's definitely doing something. And it's been shown to be as effective, if not more effective, than other treatments for things like substance abuse, smoking cessation, even promoting healthy behaviors in medical settings.
That's impressive. And you mentioned before that it's especially helpful for certain groups, like ethnic minorities and those who are more resistant to change. Any evidence to back that up?
Absolutely. The collaborative, non-confrontational style of MI seems to resonate with these populations. It builds trust and helps them feel empowered to make their own choices.
So even though MI is often used for specific challenges, it sounds like those underlying principles of empathy and collaboration have a pretty broad reach.
They do, and that brings us to something important. We can't talk about any therapeutic approach without looking at the critiques, right?
Of course, every approach has its blind spots. So let's hear what the skeptics have to say.
Okay, let's start with person-centered therapy. One common criticism, especially from the cognitive behavioral side, is that it leans too heavily on the therapeutic relationship and doesn't offer enough concrete tools for dealing with specific problems.
It's like empathy is great, but what about some practical strategies for managing anxiety or changing those negative thoughts?
Exactly. Cognitive behavioral therapists might say relying solely on the relationship isn't enough. They point to things like exposure therapy for phobias or cognitive restructuring for negative thinking as being more targeted and efficient.
It's like having a toolbox full of specialized tools, rather than just one all-purpose tool.
Right. And another critique, often from a psychoanalytic perspective, is that all that unconditional positive regard could lead to a kind of idealized transference relationship.
Okay, hold on. What's a transference relationship again? Just to make sure everyone's on the same page.
Good point. Transference is a psychoanalytic idea that basically says a client's past relationships, especially with early caregivers, can influence how they feel and act toward the therapist. They might unconsciously project those old dynamics onto the therapist.
So if you had a super critical parent, you might start seeing your therapist as critical too, even if they're not.
Exactly. And the concern is that striving for total, unconditional, positive regard might create an unrealistic dynamic, potentially making the client dependent or preventing them from working through those deeper relationship patterns.
It's like you leave therapy feeling all warm and fuzzy from all that unconditional love, and then you bump into a grumpy cashier at the store, and your whole world falls apart.
Right. Now, another set of critiques come from a cultural perspective. Remember how Rogers emphasized self-actualization and autonomy?
Yeah, that whole becoming a fully functioning person thing.
Well, critics from a cultural perspective might say this focus on the individual ignores the importance of collectivism and interdependence, especially in cultures that prioritize the group over individual needs.
So it's like, hold on, not all cultures value the lone wolf. What about community belonging, putting others first?
Exactly. And feminist critiques point out that just focusing on individual change without addressing systemic issues like sexism and discrimination misses the bigger picture. Helping women develop self-awareness and cope is important, but what about those societal structures that create those challenges in the first place?
It's like saying, therapy can teach you to swim, but it's not going to drain the pool that's keeping you trapped.
Exactly. And even from an integrative perspective, which is all about drawing from different schools of thought, some find Rogers' approach too limited. They argue that a more well-rounded approach, using different theories and techniques, is needed to really address the wide range of client needs.
It's like having a whole spice rack to choose from, instead of just using salt and pepper for every dish.
And even MI, as much research as it has, isn't without its criticisms. One concern is that its effects, while strong in the short term, can fade over time if it's not combined with other strategies to help people maintain those changes.
So it's back to that idea of integration, using MI as a starting point, but then adding in those extra tools and support to help those changes stick.
Exactly. And that leads us to a bigger reflection on the legacy and future of person-centered therapies. Even with the critiques, Rogers' contributions have had a huge impact on the field. His focus on empathy, the therapeutic relationship, and the client's potential for growth still resonate strongly with therapists and clients today.
It's like those core values have become part of modern therapy's DNA. Even if you don't practice person-centered therapy specifically, those principles are probably influencing how you approach your work, how you connect with clients, how you see the whole therapy process.
Absolutely. And while person-centered therapy might not be as dominant as it once was, it's still evolving and adapting, embracing new ideas and merging with other approaches.
It's like a river, constantly flowing, changing its course, but always moving forward. And MI, with its focus on helping clients find their own motivation, seems particularly well-suited to today's world. With everything so complex and overwhelming, that ability to tap into our inner resources and make choices that align with our values is becoming more and more vital. Well said. So as we wrap up our deep dive into person-centered therapies, let's take a minute to think about what we've learned. We started with the origins of this approach, going from Carl Rogers to William Miller, and we really dug into those core values: empathy, genuineness, and unconditional positive regard.
We talked about the research, the good and the bad, and we even heard from the critics, those who push us to think harder and realize that no single therapy has all the answers.
Yeah, and along the way we encountered some pretty interesting ideas like the actualizing tendency, conditions of worth, the power of catharsis, and how important it is to find your own motivation to change.
Right, right.
But maybe the biggest takeaway here is that it's all about connection, recognizing the worth and potential in ourselves and in others.
Absolutely.
And in a world that often feels so divided, so disconnected, that message of empathy and understanding feels even more important than ever.
I couldn't agree more.
So keep exploring, keep asking those questions, keep the conversation going.
That's the key.
And until next time, keep sending in those deep dive requests. We'll be here, ready to take you on another journey of knowledge and insight.
We'll be waiting.